All right, good afternoon, everyone. I am here today with our Health Commissioner, Dr. Duraza, and City Councilman Isaac Yitzi Seifler to provide updates on the city's COVID-19 response efforts. With the highly transmissible Omicron variant, we are seeing a rapid and alarming surge in infections, the highest during the pandemic. Before the holiday, we stood with our hospital partners who cautioned us that based on what they were seeing in their hospitals, that the next few weeks would be difficult. That is why we are building on our efforts to protect our residents. And as your mayor in Baltimore, I will continue to follow the science and enact appropriate measures to slow the spread of this new variant, as guided by our health commissioner and our wonderful hospital partners that we stood with just a few weeks ago, especially as our young people get ready to return to the classroom. And I want to thank everyone in Baltimore that has gotten vaccinated, boosted like I did yesterday morning, and those who continue to get tested before and after traveling and after attending large gatherings. The vaccine and booster doses continue to be the best defense against serious illness and hospitalization due to COVID. I want to say that again. The vaccine and the booster is the most serious thing you can do to prevent serious illness or hospitalization due to COVID. And knowing your status is key to preventing community transmission. If you may have been exposed to the virus, if you have symptoms, get yourself tested. I also want to remind everyone that we still have had continuously an indoor mask mandate in Baltimore City. I do not want to see anyone thinking it does not apply to them, because it does. It applies to everyone. If you are not actively eating or drinking indoors, you have to wear a mask. No ifs, buts, or maybes about that. We want us to be as safe as possible. Masks are essential and extend the close exposure time from 5 minutes up to several hours. From 5 minutes up to several hours, which is key when you're talking about folks who are around other people consistently. We are all in this together. I ask that everyone be mindful of our residents who have immunocompromised, our young people under the age of 5, and others who are unable to get vaccinated for legitimate reasons. Not just because they're choosing not to do so. For legitimate reasons, we have to be mindful of those folks while we are operating with folks who have a higher level of responsibility. Do not put others at risk for your small, simple, selfish convenience. We all have to do our part to stop the spread. Wear a mask, get tested, and get boosted. Get your children vaccinated, and if you haven't, get your initial vaccination now. As always, we will continue to put on social media, on our website, at the health department's hotline, the vaccination efforts that we have across the city of Baltimore. And there are a few things that I want to say before I hand it over to Dr. D to discuss the current metrics and actions specific to the health department. And we know that we are seeing long lines and extended wait times at all of our testing sites, as we are here today to increase that capacity and allow us to continue to track infections. We supported AccuReference along with a partnership with Councilman Seifler to stand up this new testing site right here at the former Pimlico Middle School, also known as the former police training facility at 3500 West Northern Parkway. I want to thank the councilman for his efforts to help get this off the ground. This is also an employee testing site for Baltimore City. And we are working with multiple partners across the city to support vaccinations and testing each and every week. And alongside the health department, we are working to further expand our city-sponsored testing sites in the coming days and weeks, and have already expanded capacity at our existing sites. And in line with these efforts, at-home test kits, we all know, continue to be in short supply across the country and here in Baltimore. And to address that issue, we have purchased here in Baltimore an additional 200,000 at-home testing kits for community distribution in the coming weeks. And that is vital that our young people, for me, that our young people return to school to in-person learning. I want to thank my federal elected officials for recognizing this need earlier this week when I was dealing with the snowstorm. Senate President Bill Ferguson, Chairwoman Maggie McIntosh, our city delegation chair, Delegate Stephanie Smith, Senator Corey McCray, and Senator Antonio Hayes. I hear from parents, teachers, but most importantly, I hear directly from students all the time who tell me, Mayor, I cannot return to virtual learning. It will not work for me. Please don't let me have to go back to learning at home. And we all know that the best place for students to learn is in the classroom, where they have the proper environment to grow and develop their mind and social skills so that they can grow to become the best versions of themselves. And while our city schools did a great job navigating the shift to the virtual learning when the pandemic started, we cannot, and our young people cannot afford any more learning loss from going back to virtual learning. Shifts to virtual learning have negatively impacted our students' social, emotional well-being, academic outcomes, and deepened racial and social economic inequities here in Baltimore. And we've seen the immediate and short-term effects, but abrupt shift to virtual learning will have long-term impacts and consequences for our students, especially those who are black and brown. And while I support a return to the classroom, as you all know, Dr. D and I, we want this to be done with the best safety and well-being of our school students and staff in mind. And to that end, today we're announcing that my administration is sending 100,000 tests, that's 50,000 rapid test kits to support testing of our students, teachers, and staff, and 80,000 N95 masks to our school system to support in-school mitigation efforts. In order to limit the spread in our schools and protect our young people, teachers, parents, and the community, I am asking that we continue to support the school system and ask them to re-emphasize masking, cohorting, and social distancing practice at schools, and to ensure maximum implementation given known limitations in school settings. And I also want them to encourage staff to receive a COVID-19 booster, even if though they are fully vaccinated. Encourage everyone over the age of 5 to get vaccinated. Individuals who are over 16 should also get boosted. We're going to continue to push to provide adequate PPE and sanitation products to all of our students, teachers, and school staff. Of course, this is N95 masks or higher quality masks or even double masking. We are also adapting new measures to protect Baltimoreans here in Baltimore who are experiencing homelessness. We are working with hospital partners, and Hopkins to increase capacity at the Lord Baltimore for COVID-positive individuals experiencing unsheltered homelessness in Baltimore. The health department is working with the Office of Homeless Services to provide detailed guidance to shelter providers, and the health department will continue to conduct contact tracing and outbreak investigations at all shelters. Lord Baltimore continue to prioritize referrals for all COVID-positive clients from hospitals and non-congregate shelters. Non-congregate shelters should have COVID-positive clients shelter in place until a referral decision is made. To protect city employees and residents and to ensure the continuation of city core services, I am encouraging all city workers who are eligible to telework to do so. The health department has also suspended in-person activities at senior centers. Additional announcements will be made as services shifted to telework, and changes will be posted at our service status webpage, which is at baltimorecity.gov/service status. And while many of our city employees will be shifting to telework, I want to take time to acknowledge the sacrifice of our frontline employees who are not able to do that. Our teachers, Department of Public Works workers, Department of Transportation, the Health Department, police and fire, and our housing employees, homeless services, who are going to be on the front line and continue to provide core services to our residents. We all owe them a deep amount of gratitude. And as indoor admission continues to drive the numbers in Baltimore, we are continuing to explore an indoor vaccine passport. The health department will be again engaging the business community in this effort this week, and community leaders during this process. Distributing information, especially through credible messengers, continues to be a central component of our strategy to battle COVID-19. The health department will be hosting a webinar featuring WBL's Jane Miller this Friday at 12 noon. I didn't know that until just now, Jane, to discuss the impacts of long COVID and other COVID general updates. Keep an eye out for more information. And as I said before, we will continue to follow the science and make informed decisions to protect our city as we have throughout this pandemic. We have done well as a city mitigating the pandemic, but we cannot and will not take our foot off the gas. We will continue to press in every way that we can to keep Baltimoreans safe. And now I will turn it over to Dr. D for more specifics about our metrics and where we are. Dr. D?
Good afternoon, and thank you, Mayor Scott, for your continued leadership during the pandemic. I also want to thank Councilman Schleifer here today and Rabbi Tindler and the AccuReference Testing Group for bringing these additional testing resources to the community. I want to thank our other partner, 5 Medicine, who is providing employee testing here, as well as vaccination support across the city. I'll begin by providing some data updates. Because of the Maryland Department of Health data breach in early December, we currently have limited ability to update our public-facing dashboard with case data, including the number of positive cases, but this information is accessible on the state public health website at coronavirus.maryland.gov. MDH's dashboard indicates our positivity as of January 3rd was 33%. Their dashboard also indicates our current 7-day average case rate is 252 cases per 100,000 people, which supports that we are experiencing high community transmission. In general, Baltimore City has been experiencing highs in new cases, percent positivity, and hospitalizations within this last week and last few weeks. The number of hospitalizations we are seeing, along with our preliminary case data from MDH, indicates we're seeing more cases now than at any other time during the pandemic. As of January 3rd, city hospitals were at 86% capacity in the ICU and 88% capacity in acute care units. For reference, on December 20th, there were 306 patients occupying beds in city hospitals with COVID-19. On January 4th, there were 822 patients with COVID-19 occupying beds in city hospitals. This is a 170% increase over the past 2 weeks, and it's the highest total number of COVID-19 hospitalizations we have seen since the start of the pandemic. If there is any good news from the data, it's that we are seeing more hospitalizations for those needing acute care compared to earlier in the pandemic when ICU cases were overwhelming area hospitals. But on the downside, with the spread of the Omicron variant as reported nationwide, Baltimore City is also experiencing notable increases in pediatric hospitalizations due to COVID-19. These overall increases in hospitalizations are straining our healthcare system. What is also concerning is that as we saturate our healthcare systems with COVID-19 patients, there is less ability to care for people with other serious illnesses that require hospitalization. Given this ongoing surge in hospitalizations threatening to overwhelm our healthcare system, I would ask that everyone please reserve emergency room visits for true emergencies. Please do not go to the emergency room to request a COVID test. I also ask that you not go to the emergency room if you test positive and are only experiencing mild symptoms. In this case, you should stay home and self-isolate. If you go to the emergency room just for a COVID test, you may be turned away, face long waits, or potentially become exposed to patients who are COVID positive. Again, please do not go to the emergency room unless you're experiencing severe symptoms. The surge we're seeing also stresses the importance of being up to date on your vaccinations. The COVID-19 vaccine remains the best public health measure we have to protect people from COVID-19, slow disease transmission, and reduce the likelihood of new variants emerging. It is also our best defense to protect those age groups not yet eligible for vaccines, specifically our children under the age of 5. If you haven't gotten your first dose of vaccine, please get it. Our previous hospitalization data still indicates the majority of those admitted are unvaccinated. If you're due for your second dose, get it. Completion of the series is required to get adequate immunity. And lastly, if you're eligible for a booster, get it immediately. We know that the immunity gain from the initial vaccination series decreases over time, and getting that booster helps to bolster our immune system's ability to fight off COVID. A recent and important update is that the Pfizer booster can now be taken 5 months after completion of the 2-dose vaccine series, as opposed to the previous 6-month recommendation. Everyone over the age of 16 is also now eligible to receive a booster, and later today, the CDC will be reviewing recommendations to approve boosters in children aged 12 to 15. As a reminder, our children 5 to 11 years of age are also now eligible to get the 2-dose vaccination series from Pfizer. The CDC also recently approved a 3rd dose for children between 5 and 11 that are immunocompromised. Please go to our website to learn where you can get vaccinated in Baltimore City. That can be found at covax.baltimorecity.gov. Again, that's covax.baltimorecity.gov. I know many are also concerned about the implications of the Omicron variant, and I want to start by saying we continue to learn more and more about the Omicron variant every day. What we do know is that it spreads quicker or is more easily transmitted from person to person, and according to the CDC, it is the dominant variant here in the U.S. We also know that this variant seems to decrease the efficacy of vaccines in preventing COVID-19 infections. However, getting both doses of either the Pfizer or Moderna vaccines and the booster still helps to reduce the risk of being hospitalized, having severe illness, and dying from COVID-19 if you do get infected with the Omicron variant. There is growing evidence that Omicron causes milder symptoms in the Delta variant. Unfortunately, even though those symptoms are milder, our most vulnerable populations, and especially our unvaccinated, are still being hospitalized in record numbers. I want to be clear that although vaccinated individuals can still get infected with COVID-19, the majority of those being hospitalized and dying from COVID-19 are unvaccinated. According to the CDC, again, unvaccinated people are 6 times more likely to test positive than vaccinated people, 9 times more likely to be hospitalized, and 14 times more likely to die from COVID-related complications. The key takeaway here is that being fully vaccinated dramatically decreases your chances of severe illness, hospitalization, or death from COVID-19. We recognize testing remains in high demand and is an important tool for early identification of disease. To support this increased demand for testing, we have increased capacity of the city's existing testing sites, and we're working with partners like Councilman Schleifer and the AccuReference Testing Group to open additional testing sites across the city. As Mayor Scott mentioned, we have also ordered additional rapid test kits to be distributed to schools and community partners upon arrival. I know that these are difficult times, and with increased community transmission, some of our family, friends, and neighbors may contract COVID-19. We know what we need to do, and we have the tools that work to decrease COVID-19 transmission in our community. If you test positive, remember, stay home and isolate and manage your milder symptoms at home. If you experience severe symptoms, please seek medical care. Don't forget to stay masked and distance in public spaces, regardless of vaccination status. Continue to avoid large crowds or gatherings. If you haven't already, please get vaccinated and boosted. If you are already vaccinated and boosted, strongly encourage your friends and family to do the same. This simple act may save a life. Thank you.
Thank you, Dr. D. And I just want to reiterate that again, that we know that getting vaccinated may save your life. This is now, you hear from Dr. D, you hear from our hospital partners about the overwhelming majority of the folks that are in the hospital for COVID, and those who have serious COVID implications, those who are dying from COVID, are those who are not vaccinated. This is no longer up for debate. It's the fact, it's truth, and we have to continue to push everyone that we know to get vaccinated. And with that, we will take some questions. Jane? Hold on, Jane. I think he's going to turn it on.
According to the data from per case rates per 100,000 people, Baltimore City is one of the top 5 highest rates in the country. I mean, how do you explain that it is such a high rate?
Yeah, I will let Dr. D start, and I'll come behind her, Jane. Dr. D.
You know, one thing that has been talked about a lot in the media is that early on, we were spared some of the more severe outcomes that we were seeing across the country. And as such, I think a lot of people, when we thought they might be at risk because of our high level of comorbidities, because of how densely populated we were, we didn't see that many cases, or as many cases as folks thought. Now people are fully mobile. They're moving around at same or higher levels than they did pre-pandemic, and the risk is there. We know that even if you're vaccinated, you can still get COVID-19, and I think that sometimes gives us a false sense of security, and so we really are seeing people are mobile. People are engaging with other people. We're still a densely populated area. We still have obviously these other high level of comorbidities, and so we are seeing this significant increase in cases that we maybe were spared of early on. We're seeing that now as people are moving.
Yeah, and I would just simply say, Jane, I think that along the lines of what Dr. D just said, like, people relax. And you can't relax when you're and this is literally a war against this. This is Baltimore versus COVID. And we have to continue to press every day. Even though, especially as we moved into the holidays, we knew that folks wanted to be with their families and had been not having traditional holidays for 2 years. And we have to continue to, with the same vigor, do the mitigations and things, because it can impact everyone, albeit Omicron being less severe.
Just one second question while you're at the podium. Is there anything that the state could do that would be especially helpful in Baltimore?
Well, I think, for me, I think if you ask a question about the state, Jane, I would think about, do I think the state, everybody in the state should have a mask mandate, should be statewide? Absolutely, it should be, right? I think, and when you look at the history of COVID in the state, and you look at how Baltimore and Prince George's and Montgomery have fared, and the length of time we've had those, data would support that being helpful. I think providing, especially for the school systems here and across the state, providing more testing to go directly to at home with students and teachers would be another thing. And other things that come to mind, we'll let you know. Sir?
Mr. Mayor, kind of a logistical question here, but those 200,000 rapid tests that are going to be distributed in the community, do we know where those are going to be distributed yet?
Yeah, so Dr. D will talk about the process, but we know, like, we've had community partners, we had our libraries giving them out, Safe Streets giving them out, other community organizations. I'll let Dr. D run down the list of how that's going to be done, in addition to the ones that were given to the school system. But for us, this is going to be focused, again, on areas where we know they're needed the most, where we're seeing a transmission, where vaccination rates are lower. We want to do this in an equitable way to focus on where we know the impact and where folks are harder to reach. Dr. D.
So as Mayor Scott mentioned, we will continue to focus on areas that we know have low or poor access to testing. When we first had the at-home test kits, we had about 54 community-based organizations, did a soft launch with those groups, included the libraries, some of our testing and vaccination site, our syringe exchange services program. We now have more than 300 community-based organizations that have registered to be eligible. And so we'll go through that list just as we did the first time, again, focusing on areas where we know testing access or vaccination status is lower compared to other parts of the city.
Thank you.
Sir?
Hi, Mayor.
How are you?
Good. I talked to some of the people here in line, and they had waited for hours today, and it's not just here to get the test, it's everywhere. How frustrating is that, years into the pandemic now, that it's really hard for people to get tests, and are you getting the help you need to get tests from the federal government or from other sources, and how hard was it to procure the rapid test that you just talked about?
Well, I think we know the demand for testing increased very rapidly, right? We know that a lot of folks, we had testing sites, but that demand came very rapidly. For this one, no one has waited an hour yet, as it didn't start until 12 noon today. But it is frustrating, but we also know that we're working with all of our partners at the state level, at the federal level, here locally. It wasn't that, I don't think it's particularly hard, speaking with Dr. D, to acquire those. We know they'll come in different ways, but it's about doing everything that we can do. But I think it's also important, too, that we make sure that we are supporting people to get the test, but also that when we're getting people in, having folks get tested in a way that's respectful, especially of those who have symptoms, right? It's about making that mark as well. It is frustrating. We know we're going to have to be patient, right? This testing, waiting for testing, lines and testing is something that is happening around the country. It's not something unique to Baltimore or unique to our state, and we're going to continue, as I said earlier, as Dr. D said earlier, to expand our capacity. As you can see, this line is moving very, very quickly because it is very efficient, and we're going to push to be more efficient in every testing site that we have.
And I don't know if this is better for Dr. Terraza, but are there any particular groups, age groups, areas that you're concerned about, or is it just everybody right now with this huge spread that we're seeing?
Well, I know Dr. D knows what I'm about to say. I'll start. As has been with the pandemic, we know that our seniors are the ones who will get sick, or the most severely or most likely to get sick. But for us here in Baltimore, yet again, it's younger people, folks between 30 and 39, meaning my age group, and 20 and 29 who are contracting it the most. And that means, again, that those younger people have to have a higher sense of responsibility, because it can mean that you're taking this and you might have Omicron and not know, and take it over to your grandmother's at Christmas, and then she ends up on a ventilator, or give it to your father or someone else. We have to be more responsible. Just because we have immune systems that are more likely to be able to sustain this doesn't give us the authority to be reckless with other people's lives, especially those who we love. Dr. D?
Yeah, I mean, I would agree. I think because of the high level of transmissibility with Omicron, because of how widespread it is, we're all at risk. I've said this throughout. Anytime you leave your house, and engage with people who are outside of your household, you're at risk. And so do everything you can to protect yourself. That includes getting vaccinated and boosted. That includes, masking indoors. That includes the avoidance of large crowds and large gatherings. But everyone is at risk.
Thank you.
Alexa? I was waiting for somebody to do that, Alexa. Yeah, you're good.
On topic. We started off 2022 with the double homicide, ages 16 and 17. Are you able to give the people some sort of idea of what the motive was in that case? At the age that we have, obviously very concerning loss of life.
Yeah, no, it's a very concerning case. It's we are still, our homicide detectives are working very diligently to figure out what's going on with that case, Alexa, as they do in all cases in Baltimore. And as soon as we have further information, we'll be able to bring that to you guys, as we always do. But as you know, we have the best homicide detectives in the country, and they will work this case and get every bit of information possible. And just ask anyone that knows who killed these young people to share that information with us. You can always give it to the homicide office by calling 410-396-2100.
By chance, have you been in? Oh,
You're good.
By chance, have you been in touch with? By chance, have you been in touch with anyone in the family?
No, not as yet. There's a process for when they ask me to reach out. Once we hear from BPD about how they want me to do that, I'll do that as I always do. Thank you. Anybody else? Thank you, everybody.